The Coma Glasgow scale provides a clinical index of the overall acute impairment of brain function, or so-called conscious level. When it was described, features of focal dysfunction such as brainstem signs were not incorporated and instead were intended to be assessed separately. Nevertheless, there have been views that indices or scores that combine an assessment of conscious level and brainstem function may have a useful place. Coma Glasgow scale assessing 3 points like eye-opening response, verbal response, and motor response. For eye response, they are giving maximum of 4 point and 1 point for no response. For verbal response, 5 points maximum and 1 point for no response. And for motor response, giving a maximum 6 points and 1 for no response. So they are assessing in this way. For example, eyes no responding, 1 point. Opening eyes, 2 points from pain stimulation. 3 points for opening eyes to verbal stimuli or commands or speaking. And spontaneous open with blinking at baseline, 4 points maximal. For verbal response, 1 if no response. Incomprehensible speech, 2 points. Inappropriate words, say something but is not clear, 3 points. Confusing conversation but able to respond answers to answer questions, 4 points. And oriented and normal verbal contact, 5 points. Motor response, 1 point if no response. Extension response in response to pain, 2 points. Flexion in response to pain, 3 points. Withdrawals in response to pain, 4 points. Purposeful movement of painful stimuli, 5 points. And obeys commands for movement, 6 points. So we have 3 components: eye, verbal, and motor. How about interpretation of the scoring? Individual elements as well as the sum of the score are important. Patient with score of 3 to 8 or less than 8 are usually considered to be a coma. Generally, brain injury is classified as severe injury less than 8 points, moderate from 9 to 12, and minor more than 13 points. For example, patients with tracheal intubation and severe facial eye swelling or damage make it impossible to test the verbal and eye responses. And in these circumstances, the score is given as 1 with a modifier attached. The score is given as 1 and with a modifier attached. For example, eye opening, verbal, and motor. So eye opening, if facial traumatism, only 1 point. Verbal response, patient is intubated, only 1 point. So we have 2 points here. And motor response, flexion in response to pain, for example, 3 points of total, and it will be like 5 points, but we are adding, like as you see here, C closed eye and T for tube. Tube and closed eye, so 5 TC. Leaving a motor score of 3 for abnormal flexion. So the Glasgow Coma scale has limited application for children, especially below age of less than 36 months, where the verbal performance of even a healthy child would be expected to be poor. Consequently, the Pediatric Glasgow Coma scale were developed. So once again, normal is from 13 to 15 or 15, generally speaking. If less than 15, but more than 13, it is called minor Glasgow Coma scale brain injury. Moderate from 9 to 12 and less than 8 is considered severe Glasgow Coma scale. And of course it is coma. Patient is in coma. Thank you very much for watching. Also, you can take a look at the links attached below and reading by self and directly from sources from which I found this information. Thank you very much and have a nice time.